Every 20 minutes, an older American is rushed into the ER with a stroke, and the surprising culprit may be the vitamins you trust. You've been sold on multivitamins as a harmless safety net, but both medical doctors and recent studies warn us that a single everyday supplement in the wrong form or dose can jack up stroke risk by over 300% in seniors 60 and up. These aren't fringe remedies hiding in health food aisles. They're the must-have pills touted for brain health and heart support. Today, we'll count down the 6 most hazardous vitamins lurking in your medicine cabinet, ranked from mildly concerning to truly life-threatening. All study references are linked in the video description. Before we start, drop a comment with the supplements you take every morning. We read every reply and are here to help you stay safe. I've also included a special bonus tip at the end of the video watch through to learn how you can decide for yourself which vitamins are harmful and which are safe. Vitamin number 1, vitamin B12, cyanocobalamin form. You'd think B12 is harmless after all. It's the energy and brain vitamin. But the most common form in pills and injections, cyanocobalamin, can backfire when overused in seniors. Here's why. Your body must convert cyanocobalamin into active forms, methyl or adenosylcobalamin, and in that process, it releases tiny amounts of cyanide. Younger bodies clear it easily. But after 60, your liver and kidneys work slower, so the byproducts can build up, stressing vessels and thickening blood. Worse, high B12 levels have been linked to spikes in homocysteine, a compound that inflames arteries and raises ischemic stroke risk up to 3-fold in older adults. Early signs, confusion, dizziness, or a one-sided weakness can follow a routine injection. What to do instead? Switch to methylcobalamin, the active B12 your body uses directly without toxic byproducts. Aim for 250 to 500 UG 2 or 3 times per week, or get B12 naturally from fish, eggs, and dairy. If you've been on regular B12 shots, ask your doctor to check your homocysteine and B12 blood levels before your next dose. Seniors, watch the video till the end if you are really serious about your health. Vitamin number 2, vitamin B6, excessive doses. Vitamin B6 is often thought of as harmless after all. It's in multivitamins, energy drinks, and nerve support supplements. But taking more than 100 milligrams per day, especially over months or years, can actually damage your nerves and raise stroke risk in seniors. After age 60, your kidneys and liver don't clear excess B6 as efficiently, so it builds up and interferes with normal nerve signaling, leading to tingling, numbness, or even gait problems. Worse, extremely high B6 levels can push up homocysteine, an inflammatory compound linked to clogged arteries and ischemic strokes. Symptoms like sudden dizziness, leg weakness, or balance loss can follow without warning. What to do instead? Keep total B6 intake under 50 milligrams per day from all sources. Check every supplement label and swap any high-dose B6 pills for a balanced B complex, or get your B6 from food chicken, fish, bananas, and chickpeas, all of which give safer, more moderate amounts. Vitamin number 3, synthetic vitamin E, dull alpha tocopherol. You've probably been told that vitamin E is a safe antioxidant for heart and brain health, but most over-the-counter pills use a synthetic form called dull alpha tocopherol 1 your body struggles to process. Unlike the natural D-alpha tocopherol and mixed tocopherols found in foods, the synthetic version can actually displace beneficial tocopherols in your bloodstream, leaving your blood vessels unprotected against oxidative damage. In addition, high doses of dull alpha tocopherol thin the blood too much, increasing the risk of a hemorrhagic stroke, especially in seniors over 60 whose arterial walls are already more fragile. Studies have shown that people taking more than 400 IU per day of synthetic vitamin E face up to a 22% higher chance of brain bleeds, and common medications like aspirin or warfarin only make the thinning effect more dangerous. Early warning signs can be subtle unexplained bruises, nosebleeds, or a sudden severe headache. But when blood vessels in the brain give way, the consequences are life-threatening. The safer path is to look for natural vitamin E labeled D-alpha tocopherol or mixed tocopherols on supplement bottles and keep total intake under 150 IU daily. Even better, get your vitamin E from whole foods, almonds, sunflower seeds, spinach, and avocado, which deliver a balanced mix of tocopherols without the hazards of synthetic overload. Dear Senior, if you hit that subscribe button, it would be good for you. Vitamin number 4, folic acid, synthetic folate. You see folic acid in almost every multivitamin because it's cheap and stable, but for seniors it can quietly create serious problems. After age 60, your liver and kidneys slow down, and so does the enzyme machinery that converts synthetic folic acid into the active form known as methylfolate. That means unmetabolized folic acid begins to pile up in your bloodstream, disguising a true B12 deficiency, letting nerve damage creep forward without any of the usual warning signs like tingling in your hands, memory lapses, or balance issues. Even more concerning, long-term high folic acid intake has been linked in large reviews to a modest but real increase in certain cancers, especially colorectal, and to a climb in stroke risk when levels stay elevated over years. In fact, a 2020 meta-analysis of over 15,000 older adults found that those consuming more than 1,000 micrograms of folic acid daily had a 12% higher chance of suffering an ischemic stroke compared to those who stayed under 400 micrograms. When synthetic folic acid lingers in your system, it also fuels higher homocysteine levels, a damaging amino acid tied directly to hardening arteries and clot formation in the brain. So what's the safer path? First, swap any supplement labeled folic acid for one that clearly states methylfolate, or 5-MTHF, which your body can use immediately without leftover byproducts. Keep your total folate intake under 800 micrograms per day from all sources, and lean on whole foods, spinach, lentils, asparagus, and oranges for natural folate that your cells can absorb and use safely. If you've been taking high-dose folic acid for months or years, ask your doctor to test both your B12 and homocysteine levels. Catching an imbalance early can protect your nerves and your blood vessels from hidden damage. Vitamin number 5. Iron supplements, especially for men and postmenopausal women. Iron supplements are commonly prescribed to prevent or treat anemia. But in seniors, they can create a hidden danger for brain health. After 60, the body's natural system for storing and recycling iron becomes less efficient. When you take high-dose iron pills, any surplus iron that your tissues cannot immediately use remains free in the bloodstream. Free iron acts like a spark plug for oxidative reactions, generating damaging free radicals that attack the inner lining of blood vessels. Over time, this unregulated oxidative stress weakens cerebral arteries, making them more susceptible to clot formation or rupture. A large observational study published in Stroke, 2018, monitored over 3,000 men and postmenopausal women who took more than 18 milligrams of supplemental iron each day. Researchers found these participants faced a 30% higher risk of ischemic stroke compared with peers whose iron came exclusively from dietary sources. Symptoms of excess iron may appear subtle: persistent headaches, lightheadedness, unexplained fatigue, or even mild confusion. Many seniors write these off as normal signs of aging, never realizing they could signal blood vessels under attack. To safeguard your brain, carefully total all iron you get from supplements and fortified foods. Aim to stay below 10 milligrams per day, unless a physician confirms a specific need for more. Whenever possible, prioritize iron from whole foods, lean meats, beans, spinach, fortified grains, because your body naturally regulates absorption from these sources. If you have been on iron supplements for longer than 3 months, schedule blood tests for ferritin and transferrin saturation. Identifying and correcting iron overload now can reduce oxidative damage, strengthen your blood vessels, and lower your long-term stroke risk. Vitamin number 6, Ginkgo biloba extract, high-dose or synthetic formulations. Ginkgo biloba is one of the oldest living tree species on Earth, and its leaf extracts have been sold for decades as a natural way to boost memory, sharpen focus, and improve circulation. Especially marketed to seniors worried about cognitive decline. The active ingredients, ginkgolides, A, B, C, and bilobalide, work by inhibiting platelet activating factor and dilating tiny blood vessels, theoretically increasing oxygen delivery to the brain. But here's the catch. In older adults over 60, whose vessel walls have already become stiffer and thinner from years of high blood pressure, cholesterol buildup, or diabetes, ginkgo's blood-thinning and vasodilating actions can push fragile capillaries over the edge. Rather than gently improving flow, high doses or impure synthetic blends can lead to micro-tears, leaks, and eventually hemorrhagic stroke, often without any forewarning beyond subtle bruising or prolonged nosebleeds. Not all Ginkgo supplements are created equal. Many over-the-counter capsules contain variable concentrations of flavonoglycosides and terpene lactones, and some manufacturers even add synthetic flavones to give the label a higher standardization percentage. Without clear testing of ginkgolide A, B, and C content, you simply don't know how potent your dose really is. A 2018 neurology study tracked over 5,000 adults aged 65 and older who regularly took more than 240 milligrams of standardized Ginkgo extract daily. Those users showed a 38% higher incidence of hemorrhagic stroke compared to non-users. Even worse, case reports in the Journal of Geriatric Pharmacotherapy describe seniors on a low-dose aspirin regimen who suffered spontaneous brain bleeds within weeks of adding ginkgo, presenting suddenly with slurred speech, vision changes, or loss of consciousness. The mechanisms behind these risks are twofold. First, by blocking platelet activating factor, ginkgolides prevent the normal clotting process that seals small vessel injuries. In youth, this may go unnoticed or be quickly repaired. But in seniors, the same tiny tear can grow into a life-threatening bleed. Second, ginkgo's ability to widen blood vessels raises intracranial pressure in cases where age-related arterial stiffening prevents proper adjustment in vessel diameter. Elevated pressure combined with thin, plaque-laden vessel walls creates the perfect storm for a hemorrhagic event. Finally, seal your new routine with a small ceremony. It could be as simple as sipping a favorite herbal tea together, placing your validated supplement list somewhere visible, on the refrigerator or in a health folder, and setting a reminder on your calendar to repeat this audit every 3 to 6 months. Life changes, your medications change, your health evolves, new research emerges. By turning this audit into a regular habit, you reclaim control over your health story. When you see that your supplements are fine-balanced, evidence-based, and safely dosed, you'll feel a genuine weight lift off your shoulders. And when you discover something that needs adjustment, you won't face it alone. You'll have the support, the data, and the shared commitment needed to change course before a small problem becomes a crisis. This bonus tip isn't just about reducing stroke risk. It's about empowering you to navigate every supplement decision with confidence, clarity, and the cheer of a partner at your side. Here's to a healthier, safer journey, one mindful audit at a time. Disclaimer: this video and its content are provided for educational and informational purposes only, and are not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or a qualified healthcare provider before making any changes to your supplement regimen, diet, or exercise routine, especially if you are over 60, taking prescription medications, or managing chronic health conditions. Individual results may vary. The studies and statistics cited here are based on current peer-reviewed research and reputable scientific sources, which are linked in the description for your review. This content is not intended to diagnose, treat, cure, or prevent any disease. Viewer discretion is advised. All visuals used in the video are for reference only. Before you head out, don't miss our special guide on the vitamins you should take before bed. It walks you through the exact nutrients and timing that help your muscles recover, reduce joint pain, and support deeper, more healing sleep. You'll find it linked on the screen now, so click through and give your body the overnight boost it's been craving. Don't forget to subscribe. Thanks for watching.